Hello everybody, this is Dr. Richard Balikian with some tips for facelift surgery. There's a lot of standardized care for how to recover from a facelift, but there are certain things I tell our patients that really kind of make the process much easier. And it starts well before surgery. The first thing to do is to make sure you're off all your aspirin, ibuprofen, any blood thinners. That's really the best thing you can do before surgery. And the reason why is when I'm operating, if your blood is thin, it just slows everything down. And I'm focused, I'm in the groove, I'm operating really well. And when we have to stop any extra bleeding, it kind of disrupts the rhythm a little bit. We get through it, but we're not driving quite as fast as we can, and the rhythm gets a little disrupted. So the best thing you can do to have a nice result from the operating is to make sure you're off your blood thinners. In addition, it cuts down on the risks afterwards of having a hematoma, of having excess bruising, excess swelling. So really, a lot of people think, oh, it's all right, I can take my blood thinner, I have a headache, it's not gonna change my surgical result. But it really does make a big difference in the way I can operate and the way you can recover. So that's the first most important trick. Another trick that a lot of people don't know about is using hyperbaric chambers. You know, a lot of people want to get right back to work afterwards. 10 days may be too long for them. They want to make sure that they have the most improvement they can beforehand. So there are some studies, and we send our patients sometimes for hyperbaric chamber treatments, where you go into a business and they put you in this chamber for about an hour. You do it 2 times before surgery and 3 times the week after surgery. And it's shown to improve your healing process by about 30%, which can make a big difference if you're looking to get back into the office. Another thing is you'll hear a lot of surgeons say after surgery that you have to wear a head wrap for a long time and that you have to keep your head elevated while you're sleeping. And we don't believe in that. We think there are other ways of doing it, and we found that with our deep plane facelift, that you don't need to wear a head wrap after the first day. So the first night you wear that head wrap, but after that, believe it or not, you don't need to wear a head wrap. Everything's in such a good place. All the head wrap does is end up irritating the incision lines. So we found less swelling and patients much happier when they don't have to wear a big head wrap for the week after surgery or beyond. The other is lying flat. Most patients will hear from their surgeon they have to lay elevated to allow gravity to take the swelling down. But when patients do that, sometimes they sit like this and all that swelling comes to the bottom of their chin. And that's not where we want our swelling to be. So we found when you lie flat in a bed, all that swelling goes from the neck and the face back to the back of the neck and then down to your heart from there. So we've seen great improvement in swelling being diminished underneath the neck. So it's lying flat on your back, avoiding aspirin, ibuprofen, looking into hyperbaric chambers, not wearing a head wrap. Those are all really good things to think about as you do your recovery.